back pain is a silent pandemic. It's unfortunately we spend more times on looking at Instagram reels rather than looking at how to live a good life.
Back pain వచ్చినప్పుడు we should not sleep on the bed, we should sleep on the floor. Is it true?
Now I'm 25 kgs lesser. I do 40% more work every day.
So welcome to the program, doctor, and it's a pleasure to have you.
Yeah, thank you as always, Dr. Lakshmi, to be on the Yashoda talk show.
So before we dive into the serious stuff, I would like to ask you, what made you choose brain and spine over other specialties? I mean, was it your plan or it just happened by accident?
So, during MBBS, I was very clear I wanted to do something related to the operation theatre only, either it be in anesthesia or surgery, because somehow I like the feeling of being in the OR room. And when I was preparing for my post-graduation, I realized that neurosurgery is a unique branch. The principles are completely different from general surgery, and we have direct courses in India where we do a direct 5-year course. And I was lucky to get into a good place, the best in India, NIMANS. And I had a great time training there, and day-to-day working in the field made me more and more interested. And here is where I am 25 years later, happy with what I have chosen.
So we are here today to talk about one of the most common problem, that is back pain. So a problem, I think it's very universal and common. So do you think it's acting like a pandemic or it's becoming a pandemic?
So this is my favorite caption. I think back pain is a silent pandemic. It's there everywhere. And see, the basic fact occurs that, when we evolved as human beings, we were 4-legged animals. Then one of our forefathers decided to stand upright. So, and then he could see things better, and then he started using his upper limbs for dexterity. And that's how human race has evolved. But back pain is the price we are paying for evolution. Because when you are a 4-legged animal, you ask any veterinary colleague of yours, the disc prolapses or the degenerative conditions are very less in 4-legged animals. Yeah. So it's typical to human beings because the gravity is now acting on the upright spine. This is what I say, it is a price we are paying for evolution. So it's inevitable. Everybody will have back issues, whatever you do, because of the work we do, because of the lifestyle we lead, and also because of the normal aging process.
So apart from the price what you're paying for the evolution, so what are the common things which are affecting our back very secretly?
Main is basically your lifestyle. See, leading a healthy lifestyle helps the human body, but more so for the back. So adequate sleep, very important, because your muscles need rest. Second, good physical activity, because if you look at the spine is actually a conjunction of factors. Like you have the bony spine, and you have the muscle and the ligaments, which are like the thread of the bow. Like if the thread is good, the bow maintains its shape, and then you use the arrow to fire away at things. Similarly, in the spine, you have the solid the spine, the vertebral column, but which is held in place by the muscles and the ligaments. So unless the ligaments and the muscles are kept in a good taut mechanism, you will not have the spine working in the optimal, the kind of health you want. So that's very important. So I always suggest these young guys who want to build up the muscle and bulk, do not do anything unsupervised. It's like me, when training, without adequate supervision, if I try to operate on the brain and spine, I will end up with problems. So similarly, it is in any field. So unless you have a senior guiding you or a supervised person guiding you, don't do things, especially onto your own body. So it becomes like an abuse of your body. People lifting very heavy weights, 100 kgs, 150 kgs. See, unless you are supervised, you don't try these gimmicks, because this is causing a lot of problems. Earlier, we used to see aged people getting back problems. Okay, but over the decades, it's now come to younger generation having back problems. So the two-wheeler driving and also abnormal driving on the roads. Nowadays, the two-wheelers are coming with high seats. They are not ergonomically designed. It's more for style or fashion, and the speeds have increased. Moreover, the road infrastructure has not improved as well as the vehicles have improved. So you have a lot of these potholes which are happening, and then the rains make the roads go very bad. And some people go off-roading. So all these, the jarring movements have got the effect on the spine. And it has caused to early degeneration. And one more thing which is very important is proper diet. So unless you take a good hydrating diet, what you should realize is the disc, intervertebral disc, is basically made up of cartilage which has got a lot of fluid content in it. So as you age, the fluid content comes down. But even in younger age, if you don't take proper hydrating foods or fluids, and you have late night parties, you have alcohol, you smoke, and you don't take care of hydration, it will lead to early degeneration. And all these lead up to you having a bad spine and struggling for life. The problem with spine issues is back pain is that it is not a cancer, or it is not a disease which kills you. Okay, so you don't die early, you live longevity, but you have a miserable life. So you have to choose between healthy lifestyle and having a good spine over having a bad lifestyle and having an unproductive life.
So, talking about, you bring up an important point about the driving. So, what's your take on those sports bike where the person is sitting far behind and almost lying flat to drive the bike?
Yeah, it's crazy. Like you do it for a pastime, it's fine, but people are taking it to the next level nowadays, and that speeding. And what happens is when you do sudden accelerations and decelerations, also the muscles of the spine, they take a brunt. Unfortunately, they will pay a price in the future. That's what we see, being in the other end of the spectrum, treating patients with these diseases.
So undoubtedly, our lifestyle choices and everything we do secretly takes a toll on our back. And back pain, ante chala mandi, they take it for light. Okay, adi, it'll come down by itself, or if I rest for some time, it'll come on itself. But when do you think one should see a doctor for back pain?
So it's a very good question you asked. So when should you take action? So pain actually is a defensive mechanism. So like I said, in evolution, if there was no pain, then we would not have evolved as a society. Simple logic is, suppose there is a fire and a young child goes and tries to come near the fire. Okay, and she feels pain because of the fire, coming and touching the skin. The baby will not go towards fire. So it's a defensive mechanism. And it's the only language the body knows to speak to us, right? So it's better we heed to the body's language to us. So the pain means that you're troubling or abusing your body. Okay, and then you should take proper pertinent care. So what is the most important factor to take when you feel the pain? Rest. There's nothing better than rest to take care of the back pain. So initially when you're getting back pain, whatever activity you're doing, do an introspection and you will find the solution about what is causing this back pain. And if you do not get rest, pain relief, even after 2 weeks of medications and rest, then it is a time for you to consult a doctor, because then is the time for you to undergo investigations to find out whether there is a sinister cause lurking behind your back pain. Majority of times what happens is, especially in women, we have seen women's tolerance to pain is very much. Okay, and historically also and family wise also, they take the brunt of all the pain, and they, because for them the husband or the children are more important than themselves. So they tend to neglect. That is why what we see in practice is women come to us in a later stage of disease rather than men and children, because they have this ability to, absorb this pain and, not take care of themselves. So I would suggest them that do not take back pain very lightly. And if for 2 weeks of rest and medications you're not getting relief, it's the time for you to consult your nearest available doctor, whether it's a neurologist or a general physician, neurosurgeon or spine surgeon. Important is to take medical help.
So I'm sure, though back pain is very common, there are many myths surrounding this. And one of the most common question we get to hear is, back pain vachinappudu we should not sleep on the bed, we should sleep on the floor. Is it true?
I don't believe it, because I feel adequate sleep is more important, and rest, like I said. So I always advise my patients, do not sleep on the floor, because you're not used to sleeping on the floor. So what happens is, nowadays with very good foam beds available, the memory foam and the ortho foam, so they are very good, they're ergonomically designed. So you leave the mattress and start sleeping on the floor, whatever the sleep you are getting will be disturbed, and it in turn leads to a vicious cycle where your pain aggravates, and then it keeps on going onward. So I would not suggest you to sleep on the floor. I would suggest you to sleep for more time, sleep on time, make sure you get your 7 or 8 hours of rest, and take proper medications to relieve the pain so that your sleep is not disturbed at night. And that's more important than sleeping on the floor or sleeping on the hard bed. See, human body is used to certain comforts. You change it overnight, definitely the body reacts. And the number one reaction is with hampering your quality of sleep. And that leads to a vicious cycle.
So a good mattress and a pillow, it definitely has a important role to play in for back, Kantara.
Definitely. So, but even now, I would suggest you look at history. So, what were the best pillows which were used? I think the cotton mattresses are still the best because the pressure is uniform. And all our ancestors have been using that from X number of generations. So, if you are having access to a cotton mattress, which is good, I think you should go for it. There's no doubt. Being a spine surgeon, I always use a cotton mattress, and my spine is in very good condition.
So that's some secret that you've revealed.
Definitely.
So another common myth is, back pain or stay, we should not walk much or we should not lift much. Is that true?
Definitely. See, lifting much is not the issue, but how you lift is very important. So, if you bend abnormally and lift weights, you are bound to get back pain. So, always ideal postures. Nowadays, internet is available and you just Google about the ideal posture of sitting, the ideal posture of how to lift weights, how to stand. Everything is available. It's unfortunately, we spend more times on looking at Instagram reels rather than looking at how to live a good life. So, that's very important.
I think you've put it up very brilliantly. So, when someone comes to you, doctor, with back issues, so how do you diagnose or what are the tests that you usually run?
So, like I always have this 2-week rule. If the patient is not improving with 2 weeks of rest and medications, I definitely go for investigations. The best investigation tool for a back pain would be an MRI because it is safe and can be repeated again and again. And you get very good soft tissue delineation. In spite of having a big problem which is seen on the imaging, what I would always look at is a clinical radiological correlation because the number one rule in spine is do not chase images. The patient is most important. Clinical findings are still more important than what you find on the scan. So many patients come to me in practice and they keep on rattling off their diagnosis. I say, what is your problem? They say, I have had L4-5 disc, I have L5S1 disc, I got treated. I said, these are diagnoses. These are not the symptoms of the problem. So essentially finding out what the problem is and if it is correlating with the imaging findings is very important. Then you don't end up with wrong surgeries.
So I think you don't reply to people who just keep WhatsApping you their images right away to you.
That's what I keep telling them. See, you have to reply because you have to find out what their problem is. But I always tell them, an image is just an image unless we know the clinical findings. So I always ask them what your symptoms are.
సో మీరు ఇంతకుముందు చెప్పినట్టుగా ఇంతకుముందు స్పైన్ సర్జరీ అండ్ బ్యాక్ సర్జరీ అంటే చాలా మంది భయపడేవాళ్ళు ఇట్ వుడ్ బి రిజల్టింగ్ ఇన్ బ్యాడ్ థింగ్ సో హౌ హస్ దట్ ఇవాల్వ్డ్ అండ్ వాట్ ఆర్ ద లేటెస్ట్ అడ్వాన్స్మెంట్స్ విచ్ ఆర్ దేర్ టుడే టు ట్రీట్ ఎనీ స్పైన్ సర్జరీ ఆర్ బ్యాక్ సర్జరీ
Nowadays 90% of your pre-op preparation is done through imaging. So exactly what the problem is, where you have to deal with, what kind of problems you anticipate in surgery. So majority of the surgeries are now done with thinking and with analysis and stuff. So nowadays, earlier they used to say, oh, this guy is a great surgeon because he has gifted hands. But nowadays they say a good surgeon is one who does a very good preoperative preparation because skills, like my professor in implants used to say, even monkeys, if they do a repetitive act, they become good. So you don't need actual skills are nothing. If the brain doesn't work functionally and if you don't have an analytical brain, I don't think you'll become a good surgeon. So that's how things have evolved. So good diagnosis, MRI machines, CT machines, angiograms, and the technology which has evolved in the OT. And nowadays, the most important thing is what we practice safe spine surgeries in Yashoda. We always do spine surgeries under neuromonitoring. So under neuromonitoring, what structure you are dealing with, and whenever you are removing something, that it's not hampering a normal structure. So it's very evolved now with 99.99% precision. Before the surgery ends, we know how the outcome is going to be. As you know, Yashoda, we are at the forefront of getting cutting-edge technology. So we were the first to embrace neuromonitoring in India, and we are market. I mean, we show the path to others. So nowadays, now everybody is using neuromonitoring, but we have been using it for more than a decade and a half. And that's how I think our outcomes evolve and we become better surgeons and we treat our patients better.
So, given a choice, would you still stick to spine or would you change?
Oh, definitely. you know, once you get used to doing certain things and you're giving good outcomes, I think there's no point changing what has brought you success and what has brought a smile to the thousands of patients we have treated. So definitely, I'm in a happy place and I would continue to be in this place.
So, can you just summarize some quick do's and don'ts? I mean, if there's a checklist for quick do's and don'ts for a good, healthy spine, what is that?
So I think, predominantly lead a healthy lifestyle. Okay. So eat on time, have adequate rest, and don't do a lot of gimmicks on vehicles. Okay. And be careful about how you travel. Moreover, don't do anything over aggressively. See, anything in moderation is good, whether it is playing sport or whether it is traveling or driving. So you should understand that there are limitations to the human body. You understand? So we are not indestructible. So that's very important. Sometimes when you are in youth, you tend to get carried away. You think you can do all night partying, you can ride the big sport bike and nothing happens to you. But see, that will not be evident then. The effect of what you have done in your youth will be evident when you are in your 50s or 60s. And then you cannot revert it back.
I think that's important. Take care of your spine when you're young and we'll take care of you when later.
And most important, I would say, is weight. Keep your weight in check. Like if you look at our previous videos, which we had done for you for a trigeminal, you can see that I was too overweight, right? So that's when I started having this back pain. I used to have exertional dyspnea and severe pain. And then I started on this transformative journey of my weight loss. And now I'm 25 kgs lesser. I do 40% more work every day and very energetic in the evenings. So it made a lot of difference to my life. So that's what I tell my patients who are overweight and who have back pain and who think that, weight loss is not possible. I say everything is possible. The human mind is so strong that once you have decided to do certain things, no force in this nature can stop you. So heed to your body and lead a healthy life. That's what I can tell.
That's brilliant. And I think that takes a lot of determination and willpower to do anything. And finally, what is that one message that you would like to share with our viewers out there as far as spine or back health is concerned?
Anything, I would suggest that you should look back at history, how your forefathers have been and what kind of diet they used to follow. Because if you understand what we are now is about 10,000 years of evolution about how our forefathers have evolved. So in India, we have a certain diet plan and what we used to eat and what kind of local cuisine and diet. But nowadays with the fast food culture coming in, we are not used to this kind of pizza, burgers and stuff like that. So it's very important. I'm not saying that I'm a saint and I have not done that, but I have learned my lesson. So now I've gone to the traditional way of eating and traditional way of living, and I feel there's a lot of difference in how I lead my life now and how happy I am. So I think you should look at it. So anything you have a doubt, you look back at history and find out what your predecessors have done and you'll do a good job in the future. Never forget your roots.
So let's not learn the lesson hard way and just let's stick
You
to the
don't need
basics.
to reinvent the wheel, right? Like, so what people have done all these days to lead a good, healthy life, just follow it.
So thank you, Doctor, for such an informative and engaging session. It was pleasure meeting you.
Thank you. Thank you very much. Pleasure is mine too.